BD, Venflin I, IV cannula, with BD InstaFlash needle technology. BD Venflin I is an IV cannula, with InstaFlash technology, designed to minimize painful hit-and-miss insertions. The important parts of an IV cannula are luer lock plug, needle grip, injection port cap, cannula hub and wings, catheter, needle. BD Venflin I has a notch opening called InstaFlash needle technology, which is designed to help improve first stick success. Points to consider before cannulation are: aseptic, non-touch technique, clean hands, apply tourniquet, lightly palpate selected vein, thoroughly clean the site with alcohol swab, put on disposable gloves, check expiry date of cannula, remove the cannula cover and inspect for signs of damage, loosen the introducer from the cannula, do not completely remove introducer, anchor the vein by holding the surrounding skin taut using your non-dominant hand, insert the cannula, bevel it, in line with the vein and at an angle between 5 degrees to 15 degrees. Observe primary flashback of blood in the shaft of the catheter, enabled by InstaFlash technology. The catheter is completely filled with blood, and secondary flashback is available at the back of the catheter. Lower the level of the cannula and advance a few millimeters further into the vein. Withdraw needle approximately 5 millimeters. Advance the cannula further into the vein, observing for continued flashback of blood along the cannula in the flashback chamber. Apply digital pressure at the tip of the catheter to prevent any additional backflow of blood. Withdraw the needle and place it directly into the sharps container. Attach an extension set, needle-free extension set, or prepared infusion set to the end of the cannula. Points to consider after cannulation are: flush the cannula, apply a sterile transparent dressing, dispose of clinical waste as per local policy, document, ensure the insertion site is inspected regularly for signs of infection phlebitis. Use aseptic non-touch technique. Select a catheter of smallest gauge and length to accommodate and manage the prescribed therapy. Remove the cannula cover and loosen the needle from the cannula. Immediately upon insertion, look for the primary flashback in the shaft of the catheter enabled by InstaFlash technology, which confirms the correct placement of cannula in the vein. Dispose the needle in a sharps container. Secure and cover with a sterile dressing. When inserting a cannula, the needle should never be reinserted, as this may cause the distal part of the catheter of the cannula to shear off and enter the circulatory system. A cannula, following an abortive attempt, should never be reinserted, as this increases the risk of sepsis.